In honor of National Suicide Prevention Month, we want to share how mental health apps are helping youth patients cope with depression, feelings of loneliness, and more.
Joining us now to share her insight is Dawnesha Powell of Silversummit Healthplan. Good morning.
Hi, good morning. Thank you so much for having me.
It's a pleasure having you on. It's an important subject as well, of course. So there's the Silversummit Healthplan. Could you tell us that or expand a little bit on that?
Yeah, so Silversummit, we are a managed care plan that provides insurance to people who use Medicaid services and receive Medicaid benefits. We also provide insurance for people with Medicare and Marketplace in both Clark and Washoe counties.
And in talking about mental health, what are some of the signs of depression that people can look out for, whether it's family members, friends, any kind of relationship in that aspect?
So I think the first red flag, in a sense, is talking about suicide. Right, so if someone is mentioning thoughts of suicide, thoughts of death, thoughts of hopelessness, it's making sure to check in with them and connecting them to the right services. Outside of that, it's changes in mood, not being engaged in activities that they typically were in the past.
Mm-hmm. If you spot those signs or if you feel that someone needs help, sometimes it's difficult to know what to do or know what resources are available to you. So what kind of resources are available to people who are noticing family members or friends or loved ones who are struggling?
Yeah, so a great new resource here and across the nation is 988, which is a crisis call center here. And that can connect you to a clinician, to a support help immediately. Outside of that, there are great apps, and with Silversummit Healthplan, connecting to a therapist or a psychiatrist.
And how specifically, in terms of just expanding a bit on that, can Silversummit really help with those kinds of concerns?
Yeah, so Silversummit, we see it as when someone makes a difficult decision to seek out mental health care, that's a big decision for them. And so we want to remove any barriers to receiving that care. And so we offer appointments same day, 7 days a week, to a therapist or a psychiatrist, either in person or through telehealth.
I think sometimes people might feel like they're overstepping their boundaries, or they might get snapped back at, because people can be defensive. Is there common stigmas attached to, or there's certain things that people can do, signs that they should look out for, which may seem obvious, or ways that they can ease their way into communicating with someone or seeing what they can do to help first?
Yeah. It's being honest with that person to say, hey, I'm noticing that you may be struggling in this area, and I'm here to help. Right, and that help may be connecting them to a loved one who can have an important conversation with them, to a physician, to emergency services if needed, but it's just having the conversation to say, I'm here for you, I'm open to talking and having that difficult conversation.
We've talked a bit about someone else sort of seeing these signs in a person. What are maybe some signs to look out for if that person specifically is experiencing signs of depression and things of that nature that they can be aware of in terms of an internal aspect?
So if the person themselves is seeing decline from things of activities that you used to enjoy, are you shying away from your loved ones, from friends? Are you isolating? Are you feeling down? Are there changes in your mood? And being aware of your emotions and saying, hey, I'm not acting like myself.
Mm-hmm. Mm-hmm. I think another important thing, the aspect to touch on is people might feel that that they should be able to support that person, that they've been there for them in the past, where it's a clinical thing. It's a mental, could be a mental health issue. It doesn't necessarily fall on you as your fault that this person is suffering with that and that you can't help. So if you feel like you can't, you should definitely reach out to someone who's a professional who can guide you both through that situation.
Yes, exactly. So if it's a youth who's supporting another youth, get an adult involved. Right? If you're a parent and you're not sure where to turn, you can talk to your pediatrician, you can talk to your child's school. Many of them have social workers and counselors who can help support you in making some of those decisions and pointing you in the right direction.
And for our viewers watching, where can they go to learn more information or maybe just tackle some of those resources you guys provide?
Yeah, so first and foremost, go to silversummithealthplan.com. There are many apps to choose from. So one that personally I recommend to families of children who may be suffering with self-harm urges is Calm Harm, which is really great to help surf the wave of some of those difficult emotions that kids may be handling. by providing coping strategies and other distraction tools.
It's great to know that there are so many resources out there. Thank you so much. It's an important subject. Guys, for more information and to learn more about the program Silversummit Healthplan has to offer, head to silversummithealthplan.com.